I'm really pleased that this framework has come into place. It's been 2 years in the making, really, and it's an ambition that we've had as a council for a long time. The best interests of the child and the families that we work with always have to come at the centre of everything that we do, but previously the paperwork and the procedures and the policies didn't always mould around the individuals in the way that they should. So we've put a lot of work in to look at evidence-based, look at best practice across the region. It has taken a lot of work. Our office has worked really hard. I think now I'm confident that this outcomes-based model is the most effective way of working to ensure the best outcome for our children and families.
So the outcomes approach is a strengths-based or relational approach to social work. It focuses on the principles and ethos of the Social Services and Wellbeing Wales Act, that is the principles of well-being, voice, choice and control, collaboration and co-production, so that's working in partnership with families, early intervention and prevention. The aim is for practitioners to have meaningful conversations with families and with children and young people to really unpick what matters to them, what's important and what they want to achieve.
Well, in my team, the Independent Reviewing Service, we're really going to benefit from this new approach. We really welcome it. It makes things a lot clearer. It puts families and children at the centre of this process, which of course is going to be beneficial. I think an outcomes-focused approach will potentially lessen the time that children's services are involved with the family. So that is certainly better for my team. I think we will hopefully see a real benefit in terms of children's names coming off the Child Protection Register more timely, because with this outcomes-focused approach, it's much easier to track progress and to evidence when change is occurring. So that clearly is beneficial to professionals in terms of their assessment, but also really beneficial to families because they can see the progress that they're making, and I think that's really important that that's recognised. So certainly for the Independent Reviewing Service, I think it's going to be really much easier for us to evidence positive change and the maintenance of that change, but also will hopefully reduce numbers, or certainly the time that children's services work with families. So I think it's going to be really beneficial. There's no grey areas with an outcome-focused approach. It's very clear about what we're trying to achieve when we work with a family. So when I supervise my staff, I'm clearer, they're clearer, exactly what we're trying to do here. So I think it's more that we'll just benefit, I will benefit from this because there's less grey areas, and that will make it easier naturally in terms of how I supervise my staff.
Foster carers play an integral part in the care that they provide to children and the support that they provide to the local authority in ensuring care plans are met. For foster carers to work in an outcome-focused way enables them to have a clear plan, a clear direction, and in doing so, that best places them then to sort of support the children in understanding what their care plans are and sort of why those care plans have been implemented. Sometimes drift can occur in cases, so having an outcome approach to working with children sort of is quite empowering for the children. They know exactly what the plan is going to be, how it's going to be implemented, and it allows them to be sort of central to the process as well, because their views and opinions are extremely important in the care planning process. They contribute to such things such as foster care annual reviews, LAC reviews, and that's fed back to them. So quite often children who are looked after are in crisis and trauma because of their past. So having a clear plan and a direction forward will sort of undoubtedly help them.
The outcomes that we identify need to be specific, they need to be measurable, they need to be individual and unique to that child or to that family. And where possible, we need to capture those in the child or the young person's own words, or the parent's own words, so that any plan that's devised is meaningful, bespoke and specific to them.
I think a real strength of the outcomes-focused approach is really how much easier it is to track progress and to evidence change. that is just really helpful for families. When you put them at the centre of the process and they feel more in control, then they're much more committed to that process of achieving change and maintaining that change, as opposed to feeling that something's being done to them.
You know, within a profession where there's quite often a high turnaround of social workers, having an outcome-focused plan enables that if there are a change in social worker, that the new social worker coming in will have a clear, a clear sort of knowledge of what that plan is, how it's going to be implemented, what needs to happen to enable it to be implemented, and that's particularly important where we consider sort of permanence for young people, such as special guardianship orders. It's extremely important that permanence for children is secured in a timely manner, and if by adopting an outcome-focused approach, it enables us to plan effectively, have clear timescales and clear responsibilities for each of the persons within that sort of plan to enable it.
Managers and those with a supervisory role have received training in undertaking supervision using the outcomes model. There's a heavy emphasis on reflective practice and supporting practitioners to get to the heart of the matter and really understand the priority risks. Again, it models the strengths-based approach that the outcomes model does across children's services. We need to be asking, what's working, where do we want to go, how do we get there, and how do we engage families well to do that?
This approach helps them to develop skills and puts the right support around them to be the best parents that they can be. And if their children are thriving as a result of that, then I think that's the best outcome that anybody can hope for. But in terms of the work of the independent reviewing service, my team, I think for a lot of those families that we work with, a positive outcome for them will be having their child's name removed from the Child Protection Register. And this approach is helpful to them because it makes everything so much clearer. The expectations on them are clearer, so they know exactly what they need to do to achieve that. And like I said, I think any process that puts them sort of more in control, they're clearer, it is only going to be helpful and lead to successful outcomes. And of course, these are outcomes that the family themselves have identified as being required, not just professionals telling them. So, I think they're much more likely to buy into that process.
I'm really pleased to be speaking at the launch of the outcomes model in children's services here in Bridgend. I think it's so important that this model informs everything that we do, not just in the short term, but for the medium and long term. This model is about really good relationships with children and with families, understanding what matters to them, and enabling our social workers, our frontline workforce, to do what matters, and removing some of the bureaucracy, some of the systems that would have got in the way of doing the right thing. It enables us, I think, to demonstrate progress and positive change. It's very much in line with the Social Services and Wellbeing Act and doing what matters. And what it should result in for our children and families is far sooner achieving the outcomes that they want to achieve, and for us as professionals to be able to see more children remain living with their own families in their own communities, or achieving permanent outcomes, accommodation, care and support more quickly. I think this is the start of a very, very long journey, and this will be the way that we will practice, not just for the next year, couple of years, but for the next 5-10 years, and we'll see real sustainable change over that period. I think it's a fantastic opportunity for social workers to really practice in the way that they trained. We also need to see some changes in the way that our services are delivered, our commissioned services, our in-house services, so that they can respond to the really outcome-focused care plans that the social workers develop. And I'm really excited about that part of the journey, as well as the part that we've got to date. I want to thank everybody who's been involved to date. This has been a massive piece of work across the whole department, and I'm looking forward to being part and leading that journey going forward.